National Supplemental Nutrition Program for Women, Infants, and Children, or WIC, may not receive food aid in November. The National WIC Association says that millions of U.S. families could have their access to the WIC program cut off as early as November 1st. That's unless the federal government provides emergency relief. The WIC Association describes the program as a lifeline for nearly 7 million pregnant and postpartum women, infants, and young children. SNAP benefits are also at risk. Virginia Governor Glenn Youngkin just declared a state of emergency to allow the state to cover any shortfall until the federal government reopens. Multiple states have warned that SNAP benefits could run out starting on November 1st if the shutdown persists. Some states have said that the lapse in funding has forced officials to delay payments approved on or after October 16th. Joining us now to discuss this is Hadley Manning, Senior Fellow for Culture and Family at Independent Women and a Blankley Fellow at the Steamboat Institute. And we have George Carrillo, the former Democratic candidate for governor of Oregon and former director of social determinants of health for Oregon. So good afternoon. Thank you both for joining us today. Hadley, start us off here with WIC. What exactly do American families on the program receive, and what could they face if they don't receive this aid?
Sure. WIC is a program that's intended to provide nutritional assistance to pregnant women, to nursing women, to postpartum women, and to their infant children and young children. This is a program that is funded by the federal government, administered by states. I believe that Governor Youngkin's doing the right thing here by making sure that vulnerable Virginian women and children who rely on this program aren't being held hostage to the debate that's taking place in Washington, D.C. over the budget. But it is a critical program. It's one that provides infant formula, baby food, and other supports to women and children.
Okay, George, now to you. Are you concerned about this situation? How concerned are you? Should the families be worried?
I am concerned with the situation because it's going to affect about 40 million Americans. We know that the SNAP benefit program is a proven method. It definitely provides a better quality of life for individuals, especially for our children. It lowers their obesity levels. It provides them with the cognitive function that they need in order to be productive members of society. It shows that it increases their grades. It's a major concern. I think right now, for me, the additional concern is that this is continuing to lapse, this government shutdown. We really need to get both Democrats and Republicans to start speaking and coming up with a solution, a temporary solution for these subsidies, so that way we can open up the government, but one side has to start compromising with the other.
Okay, Hadley, what do you think about the situation? How do we get Democrats and Republicans working together to try to reopen the government so that the American people at the end of the day are not suffering because of politics?
You know, I'm fully aware that on a TV program, we're supposed to resort to our partisan corners, and I'm supposed to call this the Schumer shutdown, and I'm supposed to blame Democrats, but I'm going to go with a different take here, and I'm going to zoom out to a 30,000-foot view. The American people are very divided, and that is reflected in Congress. That's one reason why we don't see a lot of legislation getting passed through the traditional method of getting supermajorities in both houses and getting bills to the president's desk. Instead, this puts enormous pressure on our budgeting process, because with a simple majority, by passing a budget, both sides have been guilty in the past of trying to get their policy priorities through. Right now, it just so happens that Democrats are the team that want to keep subsidies in place that were intentionally originally passed as temporary enhanced subsidies during the COVID pandemic to increase the amount that taxpayers are covering on the premiums for people who buy their insurance through the Affordable Care Act marketplaces. If we pass a clean CR at this time, that simply means that those subsidies don't continue. It changes the premium payment for people who have, for example, 400% of the federal poverty level or more. But there are other policy priorities like WIC, like SNAP, that Republicans and Democrats have long agreed should get funding, and there's no changes to those programs here. So in order for those programs and our military members and other federal employees to continue to get paid, for our government to begin functioning again, that's where the tension is. We have to resolve whether we want to see our budgeting process become one where we debate policy priorities like these subsidies for ACA consumers, or whether we want to go ahead and pass a clean budget and have that debate separate from the budget process. Now, I realize this means it's going to make it very difficult for Democrats to keep those subsidies in place. They're using the leverage that they have right now during the budgeting process to try to keep those subsidies in place. But they're unfortunately putting the rest of America in a position where other programs that aren't up for debate are now facing problems and budget shortfalls as a result.
Okay, so George, you heard what Hadley said. What is your point of view on that?
So I believe that this is where Republicans need to negotiate with Democrats. When we think about the subsidies, the Affordable Care Act more than doubled when these subsidies were put into place, and it's working. We're being able to provide affordable accessibility to healthcare, which produces better outcomes. And so right now, without some sort of plan, what I'm waiting for is Republicans to come up and say, look, we have a plan. We were proposing this plan during this time of shutdown, but they haven't proposed anything. They just want Democrats to sign off on the current bill the way it is. The subsidies will go away, and hoping that we're going to be able to negotiate something for a longer term. My position on this is, let's take the politics out of it. Let's provide some temporary subsidies right now so that way we can actually have a debate on what does the Affordable Care Act, how does that continue to be funded? How do we allow for accessibility to healthcare to be affordable? But we're not getting anywhere right now. The House is not in session. The Senate is not moving, in either direction. There is really no negotiations happening. It's sort of this tactics of who's going to blink first. And the casualties of this will be the American people, and both parties are going to suffer the consequences for their actions.
So Hadley, you can respond if you want to, but I want to ask you, are there some alternatives or anything else for states or families should the federal government not provide emergency relief as this shutdown continues?
With regard to other programs like WIC, like SNAP, I've seen governors like Governor Jared Polis in Colorado and Governor Glenn Youngkin in Virginia taking steps right now to make sure that states can cover any shortfalls for programs that are absolutely critical, like SNAP, like WIC. However, when it comes to the subsidies in the Affordable Care Act, which really are at the center of the debate in Washington, D.C. right now, there are some states that provide various other means for people to become insured. However, the biggest problem that Democrats face is that the Affordable Care Act made health insurance so expensive that in order for most people to be able to afford it, they need huge amounts of subsidies from taxpayers. When we talk about the enhanced subsidies that were passed during the COVID pandemic, this is just in addition to subsidies that had already been in existence on the books for people below a certain FPL, federal poverty level. So the biggest problem at the center of our healthcare debate right now is just how expensive the Affordable Care Act has made health insurance. And the solution that Democrats have come up with over time is the original subsidies in the ACA and additional enhanced subsidies. And if that's the direction that you want to go, if you want to keep pouring taxpayer subsidies into a fire, fueling an increasing fire in our healthcare system, we're just going to see costs continue to accelerate. And that affects Americans of all income levels, but it particularly affects those in the middle class who aren't eligible for Medicaid or other government supports, and they're having to go out and buy this very expensive health insurance on their own. So this is a problem created by the Affordable Care Act, owned completely by Democrats. It is not one that Republicans have had a chance to resolve, and it's not one that I think we should be using the budget process to resolve. If I agree with one thing that George said, it's let's take the politics out of it. And from my perspective, that means passing a clean CR, passing a clean budget, and having the debate about healthcare policy separate from the debate about whether our government should be open or not.
So George, I think at the end of the day, it's about putting Americans first. So if we keep that in mind, what do you think is the long-term solution here?
Well, the long-term solution is we really need to be able to stabilize the Affordable Health Care Act. For years, Republicans have been trying to weaken that program. We need to also look at how do we have these bipartisan conversations? How do we come to a solution? How do we, reunite the American people, especially around the programs? All of our tax dollars are there to support our government, our way of life, and how we help out people that cannot currently afford like food and programs like the WIC benefit, accessibility to healthcare, accessibility to shelter, and financial security. These are all things that tax dollars go into that provide the quality of life that the American people know and love. But right now, we're letting our politics in the way of things. When Democrats put something forward, Republicans try to repeal it. And it's the same thing from the opposite side. We really need to start looking at what's not in the best interest of the party, but what's in the best interest of the people. And that's where our tax dollars should be going. That's where these conversations should be leading us to, because at the end of the day, we need to be able to provide a better quality of life for the American people, because this is our government.
So Hadley, I want to ask you the same question here. What is the long-term solution with, tens of millions of Americans dependent on these benefits and programs like SNAP and WIC?
Right. Well, I think at the heart of the debate that we're seeing over this budget, and more broadly speaking in our politics, is a question: do we want our safety net programs to target people who are truly in need, who are facing dire poverty, who can't afford food and shelter and healthcare and basic needs? Or do we want the government to be about funding these things for everybody? I mean, these enhanced premium subsidies that we're talking about were aimed at people in the middle class. They aren't aimed at people who are at the very bottom of the income ladder, and they aren't aimed at people who are eligible for Medicaid, which is the program that is intended to help people who otherwise truly can't afford health care. These are initially, Medicaid was a program for pregnant women, for single parents, for people who were disabled and who couldn't go out and work and afford their own health care. So the question before Americans and the question before Congress is, do we want to be a country that provides a safety net, a true safety net for people who really have a need? Or do we want the government to be about providing every need for every person? And that's why Republicans, that's why conservatives have been trying to push back against the growth in these programs, because not only does it change our safety net into more of a hammock, but it also ultimately harms the people for whom these programs were designed in the first place. And so the expansion of these programs is something that ultimately somebody has to stand against, not just because we're trying to protect taxpayers or save money, but because we're ultimately trying to protect people for whom the safety net programs were designed in the first place.
Okay, George, I just want to ask you one last question here. What advice would you give regular Americans, to talk to their local lawmakers about this situation? What message should regular Americans send to them?
I believe that they need to start communicating with their lawmakers, especially Republicans, and saying, you know what, you need to come back into session, especially in the House. We need to start having conversations of how do we open up the government again? How do we keep the healthcare incentives in place as a temporary solution for us to be able to come up with a permanent, more long-term sustainable plan for the Affordable Care Act? We have to also let lawmakers know that these programs do help. Programs like SNAP and WIC, southern states really are affected by what will happen after November 1. They need to start speaking up, because this is not about being a red state or a blue state with these programs. These programs do work. We need to fund them. We need to ensure that we're not letting politics come in the middle of saving lives, because this is what these programs do. They save American lives, and that's what we need to continue to focus on, and that's what the messaging needs to be to these politicians, to get their act together and open up the government.
Well, all right. I think it was a good discussion today. Hadley, George, thank you for coming on.
Thank you.
Thanks for having us.
President Donald Trump calls off a surge of federal agents to San Francisco. San Francisco's mayor said he had